All right, well, welcome everyone. I think we can go ahead and get started, if that's okay. So welcome to our session this afternoon on organizational health literacy, how to implement changes in community-based organizations. We are going to try to make this workshop as interactive as possible. So I'm Melanie Stone. I am with the UT Health Science Center, San Antonio, so here in Texas. Where I'm an assistant professor in our Department of Medicine and actually Department of Family and Community Medicine. And I also direct our community service learning program through our Center for Medical Humanities and Ethics. And I will turn it over to my colleague, Dr. Rosenfeld.
Hi, good morning, good afternoon, wherever you're calling in from. I think we got a couple folks out on the West Coast, so still morning for you all. Thanks for joining us. As Melanie said, my name is Jason Rosenfeld. I am an assistant professor in the Department of Medicine here at UT Health San Antonio, but Melanie and I are colleagues also within the Center for Medical Humanities and Ethics, where I direct the Global Health Education Program as a counterpart to Melanie's Community Service Learning Program. So really excited to be with you all today to talk about organizational health literacy. And our kind of experiences, lessons learned from implementing changes in community-based organizations around organizational health literacy. And we want to kind of highlight and put that in quotes to make clear that historically, organizational health literacy has kind of been looked at through the lens of healthcare organizations. And so we want to share some of our experience doing this work with both community-based organizations as well as healthcare organizations here in San Antonio. I'm going to take the liberty, since I've got the talking stick for the moment, and we've got a pretty small group. And if you're willing to humor me, because I like to build community wherever I am, I'd like to just do a one-word check-in with everybody today. So you can either share me a color or an emotion of how you are feeling today. And it is just simply one word. That's all I want to hear. And so I'll share with you that I am feeling very green. And in part because I'm getting ready to take a vacation, but green today for me. And what we'll do is, if you'll allow it, we'll just tag team people. If you want to abstain, feel free to abstain, but we'd love you to participate. So Audrey, because you spoke earlier, I'm going to go ahead and tag you.
And Jason, while we're doing this, if you mind maybe turning off the PowerPoint for a second so we can see everybody, that would be helpful.
Yeah.
My word is purple.
Thank you, Audrey. Can you tag somebody for us?
Oh, yeah, sure. Bailey.
I'll say green as well. Really green today. And Jane.
My word is pink.
Can you tag somebody for us, Jane?
Sorry, Heather.
Heather, if you're talking, we're not hearing you.
Sorry, can you hear me now?
Yeah.
All right, I'd say I'm a little gray. I think some of it's weather related here, but also it's kind of one of those weeks. So right in the middle.
Thank you. Can you tag someone for us?
How about Jenny?
Okay, I'm going to go with rainbow because I can't pick one.
Appreciate that.
And how about Melanie?
I'm going to go with yellow. I'm feeling pretty good. We're having a lot of sunshine here in Texas, and I'm excited to be with you all today. I am not sure who has not gone yet. Diana, have you gone?
Not yet. I'm going to go with blue. Just had a stressful week and have a headache, so that would be my color.
Well, thanks for being with us, Diana. I'm going to tag Misty for you.
I'll go with yellow as well.
All right. think
Has Rita gone?
Not yet.
Rita? Purple.
Love it. I think Lisa hasn't been called yet.
Oh, it's hot weather here in St. Louis.
What was the color? Sorry.
Yellow.
Okay. Thank you. I think we have Heather, have you been called yet? Or that was the what we did. Sorry, yeah, Morgan. Yeah.
Also feeling yellow.
And then Ashley has already put in the chat yellow. And Ashley, if you'd like to unmute, you can. If not, I can verbalize for you.
Sure, yeah, yellow today. Thank you.
Awesome. All right. Thank you for humoring me. Part of why I wanted to do this also is we are going to do some small group discussions here shortly. So it's nice to at least get our voices going and testing our microphones to make sure that we can engage in this. And I promise it won't be too painful. But again, excited to be with you today. Let me run through our backgrounds here. So begin with our acknowledgements. I want to just thank Melanie, and I want to thank our incredible Health Confianza team, which we're going to tell you a little bit more about here in a second, which includes physicians, nurses, public health professionals, community health workers, and a whole range of community partners here in San Antonio, which we'll tell you about more in a second, and that this presentation and the program that we're describing, and I'm not sharing my slides. Yep, thank you. Let's do that. There we go. Now you can see it. I think we've done Zoom enough by this time. And that this presentation and project is supported by a grant from the Office of Minority Health within the Department of Health and Human Services with what is the Advancing Health Literacy program, which we'll tell you about here shortly. So we have no relevant financial relationships that we would like to disclose with you today. And very generally, this is our objective, which is to describe our strategy for achieving organizational change to improve health literacy for community members, patients, and those served by the organizations that we were collaborating with. So I want to start with a quick overview of Health Confianza and the grant that made this program possible. So without going into all of the nitty-gritty details of the history of how we were able to land the grant, I just wanted to say that kind of in 2021, in the spring, the Office of Minority Health released a call for proposals for a grant called Advancing Health Literacy to Improve Health Equity Outcomes Associated with COVID-19. And this was really the first time that the federal government had recognized health literacy as a core social determinant of health, and one that was addressing health equity issues and putting substantial funding behind strategies to improve health literacy to support marginalized populations around the country. And so we were fortunate to land a grant in collaboration with the San Antonio Metropolitan Health District, which is our local public health authority here, as well as colleagues and partners at the University of Texas, San Antonio. So two different institutions. Melanie and I are UT Health San Antonio, which is a health science center, and UTSA is an undergraduate, graduate degree institution just up the road from us. And so this three-legged partnership was really focused on our team designing and implementing strategies to promote health literacy with our partners at UTSA providing the evaluation. And I start with our logo because it's really essential and fundamental to what our goal was. So writ large, the grant was focused on increasing accessibility, availability, and use of vital health information and services. So both information as well as services amongst marginalized populations. For us, we targeted both Hispanic as well as African-American communities in Bexar County, which I'll show you in a moment. But when we wanted to come up with a name and a logo for this program, this is what we landed on, because we really wanted to encapsulate the dual meaning, Spanish meaning of confianza in our work. So for those that speak Spanish, you'll know that it does have two definitions. One is trust. So we We wanted to build and rebuild trust within our community and the public health and healthcare institutions serving them, providing them with information during the COVID-19 pandemic and beyond. But we also wanted to build confidence in people's ability to identify scientifically accurate information, as well as services that could address their needs in their community. And so build confidence in people's ability to make those decisions with the ultimate goal of helping people make the best decisions for themselves. So our goal was not to finger wag and say during the pandemic, you must wear a mask or you must get a vaccine, but to provide all of the information and ideally reduce barriers to access services so people could make those decisions for themselves. So that's the genesis of the program. We love this name. We love this logo. It's really been focused on building partnerships and providing a trusting and helping hand throughout our community. So before we go a little bit further, I think everyone here has a definition for health literacy, I think, but I wanted to make sure that we level set on what it is. So according to Healthy People 2030, personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform their decision making. It is a social risk. It has kind of been starting to be packaged more as a social determinant of health in and of itself, separate from other factors, because it is associated with different health outcomes and disparities amongst our different populations. And we look at the associations between high and low health literacy. There are then associations between race and ethnic minority status, age, poverty, health insurance, et cetera. And I'll show you data from San Antonio where all of this is layered together. And the other piece that I should have said when I presented Health Confianza is we wanted to very intentionally remove the term literacy from our title because we did not want to give any potential stigma to saying you are a low literate population, so we're engaging with you, if that makes sense. So we were very intentional about not trying to define people as high, medium, or low health literacy, but ultimately a health equity program that used principles of health literacy throughout it. And again, we know that health literacy is related to emergency room visits, longer hospital stays, less likelihood of adhering to treatments, and potentially higher mortality rates. So that's our definition. So when we were looking at our community here in San Antonio, and this is a map of all of Bexar County with our zip codes, and we were thinking about who we wanted to reach with our program, we identified these 22 zip codes highlighted in red. And at the time, these were the communities with the highest social vulnerability scores. It's a composite score of stable housing, race and ethnicity, income. We also knew that these communities had the highest rates of COVID infection as well as hospitalization, also the highest mortality rates, and at the time, which was June 2021, the lowest vaccination rates. And when we also looked at our last community health needs assessment for Bexar County, these were the same communities where health literacy was the lowest. So there was a direct association between health literacy in the communities that we were targeting, and that was why we ultimately went with these 22 zip codes with the strategies that we're going to describe in just a moment, with the understanding that if we can improve health literacy both at an individual level as well as at a systems level, then ideally we can move the needle on addressing health equity issues related to COVID-19. So this is where we're going to go ahead and do a quick breakout room. I want to just see, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Let's just go ahead and do 3 breakout rooms. And I'm going to have the system just automatically throw you in, regardless of whether you know anybody or not. We're going to spend about 10 or 15 minutes in these rooms because what we'd like you to talk about is what were some of the COVID-19 health literacy strategies that you saw deployed in the communities where you live and work. And so I want you to think about it kind of writ large. What were those kind of health literacy strategies that you saw that were effective or not effective? And then I want you to take that conversation and narrow it down to any non-health care associated organizations. So think broadly, these can be schools, these can be libraries, they can be others. But what did you see? What did you hear, both effective and ineffective, around kind of health literacy strategies during the COVID-19 pandemic, the emergency phase, and even just after? Everyone kind of understand the instructions? Feel good about this? I've set it for 15 minutes. Melanie will and I will pop through the different rooms and just kind of listen. And if the conversations are stagnating, then we'll go ahead and close it and bring it back. If you can just identify one person who will report back to us what you guys talked about, we would appreciate that. So I'm going to go ahead and open these rooms unless there's any questions or comments before I do so. All right, here we go. We'll see you guys in a little bit. The last room. Okay. While we're piling in here, I don't want to take up too much more of our time here, but any kind of broad brushstrokes, kind of key themes that emerge from your conversations about effective, ineffective health literacy strategies during the kind of pandemic emergency phase or non-emergency phase that we can share from our rooms? Maybe a couple of key highlights from each room.
I'll go. In our room, I would say one of the themes that sounded most prevalent was really about meeting people where they were or where they are at the time, right? Trying not to make it so complicated for individuals to have to go seek the vaccination, but yet bringing it to them and to their communities in ways that resonate with them.
Yeah, thank you, Heather. Anyone else from one of the other rooms?
I think in our room, the key word would have been stability, particularly in terms of communication, not changing your style of communication, being consistent, being transparent, ensuring that those who were most in need had the same support as everybody else.
Yeah, thank you. And then finally, anyone from room 3 want to share key themes?
Probably just, using community leaders as important, spokespeople for what to do.
Awesome. Well, we appreciate everyone engaging in this conversation. Again, it's a little bit of a table setting to get the juices flowing and to, maybe give you some opportunities to react to what we ultimately designed for our program and then how we wanted to layer this. And so what we ultimately landed on for our program was a multi-level strategy with the understanding that it was not fair nor appropriate for us to put all of the onus on our community to change, right? To say we're going to improve health literacy amongst our Hispanic and African American communities. But we wanted to change the environment in which health information and services were provided at the same exact time. So we had community-based strategies where we partnered with natural leaders. We talked a little bit about that messenger matters, right? And then also trying to provide that consistency in communication. So we would work with faith leaders on school campuses, community health workers, provide what we called ambassador trainings to provide them with technical information to talk about COVID-19 and vaccines, and then help them identify strategies for delivering that information to the communities that they serve. We also had a peer-to-peer education model that we've been working with under this strategy, where we bring communities together to talk about this content themselves, to reflect upon it and think about what makes sense for them to do with the information that they've come together with, and blend it with lived experiences. And then we move up a level to professional health providers thinking about interpersonal communication. So we provided a number of echo sessions around how do you integrate health literacy principles into your practice as a physician, a nurse? How do you integrate it into your work as a community health worker? And really thinking about, really most importantly, how do you acknowledge people's lived experiences and perspectives? You're not always going to agree with people, but the minute you disagree with them, then you've lost the conversation. So how do we encourage that openness and curiosity, even though you may not agree with what somebody is saying, to help them find the best path for themselves? And then finally, at the third level, at the highest level, we designed an organizational health literacy program, which is what we want to talk about today. So I'm going to leave it at that, not to describe that one because Melanie's going to go into details. But the idea was that all of these strategies would be running simultaneously with the goal that we could change the systems, the environment in which we're working, so that organizations are providing more health literate programs and our communities are trying to change at the same exact time. So my last piece is to talk about this idea of organizational health literacy. This is a newish term that some of you may be familiar with, but according to Healthy People 2030, this is about the degree to which organizations equitably enable individuals to find, understand, and use information and services, right? So it's less about the individuals seeking services and information, but about the organizations providing those services and information. So is it equitable? Is it provided in plain language? And what we believe is that organizational health literacy may help to reduce health disparities in our most marginalized populations. So you can see this image here that kind of talks about the foundations of health literate organizations. It's promoted by leadership. It prepares our workforce. It meets the needs of all. It has community engagement informing the policies and practices within our organizations. But this was that third level that we really wanted to think about, is how can we help our organizations become even more health literate so they can best serve the populations that they're surrounded by and that are coming to them for health and social services. And we cast a very wide net because we realized that during our response here in San Antonio, a lot of people did not go to health services or public health agencies for their information and services. They were going to schools, they were going to faith institutions, they were going to churches and to libraries to get that information. So last piece of discussion, just a couple of quick minutes here. How would you address, thinking about this idea of organizational health literacy, think about the organization that you work for or maybe have worked for in the past. How would you try to address organizational health literacy where you currently are? Just with that definition that we talked about. A couple of quick ideas. Yeah, Melanie.
Oh, and I was just going to say, this would be a good time to stop your PowerPoints.
Yep.
You can see everybody.
So just some quick thoughts on, how would you try to either promote organizational health literacy at your organization, or how would you try to improve your organization's health literacy? Any initial thoughts?
I know at our health department, there's me and another lady that are working with our executive director to become, it's called Health Literate Champions. So it's throughout the state of Nebraska, our NALID group created this program for all of the health departments to participate in. And part of the program is creating an action plan within 2 years that make your whole organization a health literate champions. So that's what we're in the process of doing.
I love that. Thank you, Diana. Any other thoughts?
Sure. One thing we're doing as a healthcare organization is partnering with our county community health workers to come in and train physicians and clinic staff in a clinic that has a high level of non-English speaking clients, to ensure that they're following those health literacy best practices in their day-to-day work, and engaging in teach back and really just developing those one-to-one relationships so that they're more likely to think of their clinic as a community resource as opposed to an emergency room. So far, we've been doing it for about 4 months, and it's going really well, and I'm really anxious to see what the outcome is at the end of the year.
Jane, that's awesome. We're doing similar work with CHWs here. I have a question. Did your CHWs get formally trained in health literacy before they went into these clinical practices?
Yep. They, I think it's probably the same grant program that you guys are using. And they did formal training for all of their CHWs. And then they have started going out to different health organizations or health related organization and training staff all over. And we are the first health provider organization to jump in on this with them.
Wonderful.
I love that. Some of the best conversations we had in our professional training was where we had CHWs, nurses, and physicians in the same room and like making sure that we were actually talking to each other. So it was fun.
Yeah, I think it's just really important to bring that public health aspect into the actual practice of medicine. Sometimes that gets kind of put aside due to the, the whole business aspect of it. And so I think it's been a really great refresher for the our primary care leadership to see this work.
Great, thank you. I think we can take one more if anybody has it. If not, we'll move on. Okay. Well, without further ado, I think what we'll do is we'll hand it over to Melanie, who will take us through the next part of our presentation.
All right, Jason, does that look good on your screen?
Yep.
Okay, perfect. All right, so I'm going to go into the details now about what we ended up doing with the organizational level. So as Jason mentioned, we had these different levels. We had pretty strong, solid ideas about what to do at the community level. We had been doing a lot of work at the patient provider level, but the organizational level of health literacy, as you know, is a newer area in the field. Not as much work has been done, and none of us at our organization had actually done work specifically in that aspect of health literacy. So I was a doctoral public health student at the time. I've been interested in health literacy for a long time. So I decided to make this aspect of our project also the subject of my dissertation. So I tried to really put a lot of research behind it and develop it along the way. So as we've been talking about today over and over, we knew from our experience with COVID here in San Antonio and around the nation that many people in our community did not necessarily use or even trust traditional healthcare settings like clinics for their basic health information and services. Rather, they were turning to their trusted community centers, churches, food banks, et cetera, for their COVID information and later vaccines. So we came up with the idea of organizations for this level of our program. We wanted them to take a pledge to improve their accessibility and usability of their services offered to their clients. We also knew we wanted to expand this opportunity, as Jason said, to any organization where people were actually going to receive their health information, such as the varied community-based organizations and social service agencies that they had been going to for a long time. And this seemed to be, to us, the key to improve health literacy in a systemic way and ultimately increase health equity in our community, which was our ultimate goal with this program. So this novel idea of organizations taking a pledge to improve health literacy was somewhat influenced by the fact that many organizations in our community were getting certified in trauma-informed care as part of a citywide initiative. So we liked that model. We actually tried to research what a health literacy pledge model might look like, but we couldn't find any such organized pledge programs in the literature. So we started from scratch. We made this a voluntary application process in early 2022. It was a bit nerve-wracking, as Jason will attest. We weren't sure really if any organization would want to apply for this. Did they know enough to even think that this was an important thing for them to do? As part of our grant, we had budgeted for 10 organizations for this pilot. And lo and behold, we ultimately got 10 applications. So it was open to any organization. We were hoping we would get a mix of both clinical and non-clinical, and we did. So we actually got 3 clinical and 7 non-traditional health organizations, which included a couple of community centers, some housing programs, an HIV support group, and even a large public university here in San Antonio. So the senior leader at the organization provided a letter of support. So we knew that we had their buy-in from the beginning, and that's really critical. The organizations were asked to identify 3 to 5 staff members who represent different levels, such as an on-the-ground health educator, a supervisor, a manager, to be the health literacy champions who would participate in the program. And the senior leader was invited to attend, but not required. We did have a handful of senior leaders who would attend some of the programming. So the requirements to earn ultimately your pledge certificate is that the organization would first conduct an internal assessment of their environment. This would be their baseline, so that they would know what areas particularly they were going to focus on for the next phase of the program, which was a learning collaborative, which I'll describe in a minute. So that learning collaborative was going to be an 8-month commitment. Through that process, they were going to develop an organizational health literacy plan, which would have some actionable steps towards changes at their organization, mainly focused on policy and practices. We stopped there because of the timeline for the grant. But ideally, if we could have kept them longer, we would have wanted to see how those policies and practices were enacted at the organization. We are going to follow up with them. So we hope on a voluntary basis that they will report to us some of their long-term organizational changes. And then we had a media campaign that's actually going on right now to spotlight these organizations in our community. These were going to be things like physical and electronic banners, social media, radio spots, to let the community member know, what does it mean if this organization has this pledge certificate? With the idea being that that client will receive more respectful treatment, education provided on their level, the fact that the organization is going above and beyond to help them take control of their health. So as far as the Learning Collaborative, we modeled it after the Institute for Healthcare Improvement's Breakthrough Series. Some of you may be familiar with that. It's a short-term learning system for quality improvement. We had the teams meet in person monthly. We provided them lunch. And then for the didactic portion, we brought in some national health literacy experts to discuss organizational health literacy and how to make these organizational changes. These were followed by breakout periods with 2 to 3 organizations in a small group throughout the collaborative. The organizations got to brainstorm with each other and have one-on-one with one of these experts who also served as a resource mentor for them throughout the whole program to help them develop their OHL plans. And if Audrey's still on, her colleague, Dr. Marianne Abrams, was one of those mentors. So they met with their mentor during the actual session, the live session that we had with them, as well as there was an expectation that they would meet formally outside of the collaborative at least twice through a Zoom meeting. But they were actually encouraged to correspond with their mentors informally throughout the collaborative anytime they had questions and needed assistance. So in between our sessions, we had what's called action periods. This is when the team would go back to their organization, try to get that buy-in from the rest of the organization by making some short-term improvements that people could see immediately and be like, oh, this is what, this is why you're spending your time on this. I can see some changes happening already. And they were also working on their long-term plans that would require, more significant effort. The curriculum was basically these topics that you see here. We introduced them to health literacy and its role in health equity. Remember, 7 of these organizations were not health-related organizations. They provided some amount of health education to their clients, but that was not their primary focus. So we wanted to make sure they really understood what health literacy is, why it's important. We introduced them then to organizational health literacy, the 10 attributes of a health literate organization, which is our framework for health literacy established by our federal government back in, I think, 2010. We also wanted to introduce them to the class standards. Our funders, the Office for Minority Health, and they are the ones that have issued the class standards, culturally, linguistic, and appropriate services. And believe it or not, a lot of our organizations, including the healthcare ones, were not even aware of the standards. We also taught them about organizational policy making and how to develop an organizational health literacy plan. The framework that we use is the John Cotter's Steps to Leading Change. We actually provided each team with his book, hoping that they would start using that even more, but we definitely talked about it at each of our sessions. So at the end of the collaborative, the last couple of sessions, we had the teams provide peer presentations of their OHL plans before they finalized them. They provided it with each other. They got feedback from their peers and from us as, their mentors. We provided resources to the participants as we covered each session. So one example is the Unity Points Building a Health Literate Organization handbook. And so we wanted to make sure they had as many resources as we could possibly give them. We shared them through a Google Drive, so it was easily available. And then another way I wanted them to stay engaged was by filling out progress reports each month. And so we had, we reviewed them. We also shared those reports with their mentors so that everybody was on the same page. Time was the big issue, as you can imagine. They always said, we wish we had more time to devote to this, but it was good for them to kind of be accountable for what they were working on during those action periods. There were several types of benefits for the organizations to participate in the program. So, of course, we were providing some expert guidance. Our team, as the Health Confianza folks, as well as the 4 mentors that we had. So that technical assistance and mentorship was important. We also provided a stipend. So thanks to the grant, we had some money to offer to the organizations. And it ended up being $4,000 per organization that they would receive at the end of the collaborative. And that was to offset their time for participation and any costs that they may have had initially with making some of those short-term changes. So I mentioned the media attention. Earning that pledge certificate is bringing increased awareness of their organization and its commitment to health literacy. Networking ended up being really important, more than we realized. So we heard over and over from the organizations that they loved being there with their peer organizations. They loved interacting with them, sharing resources. Even whether it was related to the project or not, they started that exchange. So I'm looking for ways now to keep that networking going even after our collaborative has ended. And then one of the really cool things in terms of sustainability was that one member of their team was able to enroll in the self-paced online IHA Health Literacy Certificate Program. So Mario, you can share that with the IHA folks that was one of our benefits for them. That's valued at a $2,000 certificate training. And the idea was that then that person could be their trainer, even as they left the collaborative, that they can continue being invested in health literacy, helping train others at their organization. All right, and so This is we had a pretty robust plan for evaluation. I think part of that was because of my dissertation, but I also, as part of this grant structure, we really wanted to have some results to show. So basically, like I said, they started off with a baseline assessment. I'm going to go over the details of what we use, the HLA2, on the next slide. That was followed by some structured discussion groups, which determined from that baseline assessment what would come next, which are the action plans, short-term and long-term. At the end of every monthly session, we had them fill out an evaluation to just see what they were getting out of the experience, any suggestions for improvement, which we did make some changes along the way. For example, they wanted more time in their breakouts with their mentors, so we adjusted our schedule so that they could have that extra time. They also produced their OHL plan. That was their final deliverable. And then our partner that Jason mentioned, UTSA, who's responsible for the evaluation of our entire project, did some more detailed final end of program evaluation. So they surveyed the team, they did a focus group with the team leaders, they interviewed the mentors. They're in the process right now of analyzing that data. So we don't have it to share with you yet, but we do hope to publish those results for wider dissemination. So hopefully you guys will be able to read about that in a publication. As I mentioned, I'd like to do some follow-up. This will be outside of our grant period, but I'd like to follow up with the organizations to see what kind of results they're getting from their policy implementation, and then ideally have them take that baseline assessment again in a year to see if what they did as part of this program has affected what their initial baseline assessment showed. So this is the assessment tool we used. It's the Health Literacy Environment of Hospitals and Health Centers, or HLE2. It's got the 2 because this is an updated version from the original. There are various tools out there for assessing organizational health literacy. So you all may be familiar with other ones. We chose this one because it was one that had been identified in an expert consensus study as one of the top tools to use. It addresses all of the 10 attributes of a health literate organization. It provides detailed instructions for use with scoring examples. It also provides action points to consider to guide the organization in further action steps. So rather than just being some sort of abstract tool, it gives really clear, this is what, this is where you are at, and these are some steps that you should take. It focuses on these 5 areas, so organizational policies, practices, navigation, culture and language, and communication in its various forms. There was not any published literature of this tool being used by organizations outside of clinics and hospitals. So that was a focus for my dissertation, is can this be used for non-traditional health organizations? And the good news is that it actually worked really well. So it absolutely can be used by both clinical and non-clinical. So for standardization, I trained the health literacy teams on how to complete this assessment and provided them with an Excel spreadsheet to record their scores and write comments. And that was really useful. Otherwise, this is a PDF that you have to write on yourself. So having that scoring through the Excel was really good. They were given 2 months to complete the assessment, which was plenty of time. Each of the sections in the HLA2 contain a mixture of yes, no responses and rankings of 0 to 4. And then each section is summed into an aggregate score for that particular category and expressed as a percentage. So the way that they did this was different per organization. So 3 of them scored their HLA2 together. So they just had one final score sheet because they all did it together. Others had different team members scoring, and that resulted in multiple score sheets that I analyzed descriptively with mean percent scores and standard deviations. And then something that is not part of the tool, but I added was providing score ranges. And so depending on what their range was, they got a letter like you would a grade, an A, B, C, or D. And that really made the analysis of this a lot easier. So after completing the HLE2, we went to each organization in person, had a discussion with them, and the point of that was to accomplish 2 objectives. So the first was to review and discuss the team's scores for each section of the HLE2 if they had different score sheets. And we addressed any discrepancies so that by the end, we had consensus on what they thought their areas were scoring as. The second was to come up with the organization's short-term and long-term priority actions for implementing OHL change. We wanted them to go into the next phase of the collaborative, having some idea of what they were going to work on. Now that could change, of course, as they went through the collaborative, but rather than starting the collaborative and having, like no idea what they were going to do, this really sped up their ability to really engage in that collaborative and start making changes. They were asked to come to that structured group discussion after brainstorming previously with each other at their organization. They needed to have specific actions for each of those 5 HLE2 sections. So 5 actions per each of those 5 sections. They would bring this list of 25 potential actions to the structure group discussion. And during the discussion, we used a consensus-based decision-making process to create an environment of openness and trust. That resource is included in our resources slide with a bunch of other resources at the end of the presentation, so you can access it. And through consensus, we help them prioritize at least 3 short-term actions and 3 long-term from their list, considering aspects like feasibility and importance. So what you see on the right, I think on your right, is going to be what it looked like. It was old-fashioned, writing on chart paper, brainstorming with the group, taking their results of the HLE2, verbalizing it, and putting it down on paper so that then we could discuss, well, out of these, what do you think is really most important? What do you think you can actually accomplish knowing the environment of your organization? And then that translated to the priority action areas. So you'll see 3 short-term, which was designed to take place during that 8 months of the collaborative. And then long-term would be goals of implementation in the next 1 to 3 years. So they generally had about 3 per short-term and long-term. Some of them had more. And what the actions for all 10 organizations mainly centered around staff training on health literacy communication strategies, assessing their material for plain language, improving signage for wayfinding, and providing language and interpreter services. So those were kind of the 4 main highlights of what the different organizations would focus on. And then finally, we use the CDC template, Making Health Literacy Real, as a guide for them to develop their OHL plan. So this was their final product or their final deliverable. This plan takes them step by step, which is what we were doing with them through the collaborative, that discussing things like getting buy-in at their organization, identifying their advocates, doing an honest assessment, and finally, resulting in those action plans. We also, as part of Health Confianza, we held end of program summit in June last month. And as part of that summit, we had the organizations take their plans and put it into a poster format. So it's kind of the highlights of what's in that CDC plan, but also adding some successes, challenges, lessons learned, with the idea that this poster is a lot easier to discern than that 16-page booklet. We wanted other organizations to take notice of this and get interested, because we do want to continue the organizational pledge program for future organizations in our community. So I'm going to stop there. I'm first going to ask if there's any questions on the material, and then we'll have just a brief group discussion here about whether you think this program, this idea of an organizational pledge program might be useful in your community and how you might replicate it. But let's first start. Does anyone have any questions that they'd like to throw out there?
Hi, Melanie. I have a question. This is Ashley.
Okay.
First of all, this is a phenomenal program. So thank you so much for all of your work and for telling us all about it. The question that I have is, did you receive any pushback about time? I know you had a grant, so you were able to pay people, so that often helps with the barrier of time. But to give you an example, so I give health literacy trainings, and I gave one to our behavioral health team yesterday, and I had 20 minutes to do something that usually takes me an hour and a half. And even just getting them for 20 minutes was a big ask. So like, you know, this is my heart and soul. I always tell people health literacy is my favorite part of my job. And I want to do all of this, and I am doing a lot of this on a smaller scale due to capacity and time issues in an understaffed FQHC. So I'm just curious if you ran into that barrier and any suggestions you might have.
Yeah, that's a great question. Let me see. Sorry, I was trying to figure out how to stop sharing. Okay, now I can see you all. So yeah, time, as I mentioned, was once we got into the collaborative, it was one of the, it was the biggest issue when we asked them every month, you know, how are things going? What challenges are you having? They always said time. And, you know, we talked a lot about it. So at our sessions, we would just, you know, have an open discussion, like, you know, what is it specifically that is taking time? What are ways that we can maybe address that? It also was one of my concerns before we began the program, because these are, just like your FQHC, and one of our clinics, by the way, was an FQHC, but these are all organizations that are strapped for time, strapped for resources. They were coming out of, you know, the height of COVID. So I was worried that they would not think that they had the time to devote to this. That was not the case. So, the organizations that participated and, you know, applied, really, I think they just thought it was so important. And in fact, it may be because we were having just gone through, you know, COVID, that they realized they need to do something, right, to help their patients and clients, because maybe what they had been doing wasn't working as well as they hoped. So I don't have a good answer for the time issue. I think it's always going to be a challenge, but you know, maybe just having that expectation that, you know, this is something important, just as important as your quality improvement projects, as your, you know, patient education projects. Like, this is going to help you in the long run better accomplish your goals.
I just want to add real quick, Ashley, because again, like, yeah, what we found was also, like, oftentimes we would have the learning collaborative and people wanted to stay longer. They would want to keep talking, right? And so I know it varied by organization. And even though we offered the incentive at the end of it, we were still having to chase people sometimes to give it to them. So I'm not trying to say it wasn't 100% that way. And so time is always a challenge, right? Even with the trainings that we were providing, it's like, how do you find that time? And I think we have a slightly biased sample in our organizational program because they had dedicated themselves to this. So the time that we created for them was valued. It was harder for them to find ways to do the operationalization. And I think part of it is the relationship building and the prioritization of the issue, the training at a leadership level. And so we worked really hard to get that buy-in from the beginning so that the time would be created for the teams to do the work that they needed to do.
And I'll just emphasize that the senior leadership buy-in is so critical. It's, you know, not just our program, other studies out there. Anytime you're talking about organizational health literacy, that buy-in from that senior leadership is critical. As part of my dissertation, I interviewed each of the senior leaders who were listed on the application. So I spent an hour with them talking about the issues. And I think that was key, like part of it was so I could have data for my research, but I think also just doing that with them gave them an opportunity to really verbalize how important this issue was, because they were talking about what they were seeing with their clients, the struggles and the challenges, and what they were, hoping that could, improve with that. And so, yeah, I think having that, and I think there's things that we could have done to engage our senior leaders more, and that's probably something I would do more next time, is make them more involved, because I think the more you involve them, they will keep letting their team have that dedicated time.
That's great. Thank you both so much.
Sure. Any other questions before we jump to our discussion point?
No, but I do want to just say that from my perspective, like, we're not necessarily looking at the community just yet, because we feel like we got to get it right on the inside. But I really can see where this entire program could almost be leveraged as a champions program internally in your organization in a very similar format, right?
Yes.
So this has been very inspirational for me, and my wheels are already turning. So thank you for sharing.
Well, that's awesome. So you're already getting us discussing. So it sounds like that would be something that you would be interested in replicating. However, it would be more for your internal clinical environment. So, and that HLA2 is a great tool for you to use. That, it was designed for the clinical environment. So it's definitely something that you should start with.
Yeah, our organization actually kind of created sort of our own, if you will, because we're a payer and provider organization.
Mm-hmm.
So we've got to look at both sides with insurance and clinical settings. So the HLE2 didn't seem to do what we were looking for, but we kind of morphed it into what we needed. So
that's great. We did have an community HMO program. A health insurance provider, local provider, as part of one of our organizations. And I actually list them as a non-traditional healthcare because, they're not providing healthcare services, but they are. Well, does anyone else have ideas? Is this something, what do you think would be useful for you at your organization? Any parts of this? Would you be interested in replicating it?
Hi, this is Jenny. So one of the things that I'm hoping to take to my community and share is, so our county is just wrapping up their community health assessment and moving into the community health improvement plan process. And one of the topics that was elevated by community members was access to healthcare. But if you dig a little bit deeper into the data, what folks are really talking about is health literacy. They just don't know what the word to put to it. So I'm hoping that this is something that could be as part of, for the first time, our community health improvement plan process. And I didn't know if you guys had any knowledge or of other similar types of efforts based off of this type of work.
Well, I wish health literacy was one of our actions coming out of our community health improvement plan. It's been discussed a lot, but it's not been, like you said, it's not specifically been put in those terms. But I know that our community health leaders are aware of health literacy. And I think, having this pilot will start bringing awareness to others of why it would be good for them to engage in this process. So I guess we're in the wait and see period.
Yeah. I mean, what I think I like about this is that I think it helps make health literacy a lot more tangible and easy to wrap your brain around, and okay, this is a process of how we could actually use this in our community instead of being at such a high level.
And if I can, I wanted to react to that, Jane, because I think it's an important piece. And again, it came back to part of why we didn't want to have literacy in our name to just for that purpose. But then it also created a challenge sometimes. And so with this pledge program, one of our participating organizations was the YWCA, the Young Women's Christian Association. And while they were invested to begin with, the leaders on that program had to spend time convincing their leadership that this was important, because they're like, well, we don't do health. But it was it's because we think about health as health care, and we don't think about it as the social determinants of the places where we live, work, and play. And they were able to effectively make that case for them, because I think we empowered them with the information about what health literacy is, and did some co-creating and co-defining. Like, for me, that's one of the most important parts of this, is like, I would suggest, as you're moving into that implementation phase, is to have those community stakeholders in the room so that you can help define what this is, and then even say, here are metrics that may be health literacy tangential or directly related that we can strive towards, so that people can see, oh yeah, like who my messenger is a piece of this, or whatever it might be. So anyway.
Yeah, thank you.
Mm-hmm.
And with the YWCA, and I forget who is our marketing person here. Is it Heather? Am I getting that right? It was getting that marketing folks from the organization. When she got that person, their marketing manager, on the health literacy team, it made all the difference. So now, that person who works with all of the different areas of the organization, the non-health parts of it, she started seeing, well, making these changes for health literacy actually is going to improve all of our other areas as well, in terms of having their information readable, having their, services able, clearly how to get there, their signage, like all the different things. She kind of made that connection. And then I think that was the turning point for that organization. So marketing folks are crucial, along with the senior leaders. Anyone else want to throw out their ideas? And I think we're getting on time here. We have a few more minutes. Maybe we can have one more person share, and then we'll wrap up.
I know I already talked, so I don't want to jump in if anyone else has something to say. Okay, so one thing I'm actually working on right now, it's going to start in September, is I have some DNP, doctor of nursing practice students, who did a small informational interview with me a couple of years ago, and they said, I'm going to remember that you do health literacy down the road when I need to do my practicum. And I said, okay, you do that, and they did. And they're actually going to do their practicum with me in the fall, doing an organizational health literacy assessment of 6 of our main clinics. And the goal is for them, like you said, time is an issue. So I'm trying to use these DNP students. It's a win-win. They have time, they need the project, they do the assessment, and then I bring that assessment to senior leadership to hopefully do some of what you've done, identify champions, and really advocate for the need for change, and that the assessment doesn't go to waste. So I really just appreciate all the information you've shared today.
Well, thank you, Ashley, for sharing that. That's actually a really good point that we probably need to talk about more, because we have, being at a health science center, we have a school of nursing, we have the same program with DNP students looking for practicum sites. So we made that connection early on, and then I offered these students to the 10 organizations. Only one took us up on it. It was a clinic, and I think they had a really great experience with the DNP students, but the others didn't. And there's probably, we need to figure out ways to make that connection more, because I think you're right, like have the students do a lot of that legwork while you're monitoring and, working with them, but that will save you time. So that's a great point. Well, thank you. Thank you all for sharing that. I'm going to actually, Jason, if you want to go back, I think you're going to share some data with us, and then we can wrap up with our contact information and our resources.
1 second. Oops. Come on. Hopefully you're seeing those slides, picture of all of us.
Yes, we are.
Do you want to quickly talk about the future, and then I'll go to the last one?
Sure. So as I mentioned, we are at the end of this grant program. It was only a 2-year grant, so pretty short time frame. But with our initial success of this pledge program, we are looking for ways to sustain it and move forward. We've already had organizations like reaching out to us saying, when can I join? I really want to join next round. And so we're in the process right now of trying to figure out how we can get the funding that we need to sustain it. When we have our next iteration, we'd also like to do a little more outreach to organizations in our community that have a really wide community reach, the public library system. I was even thinking of like we have a really big grocery store chain, and like a lot of people go to the grocery store not just for their food, but to talk to the pharmacist, to the nutritionist. So with these efforts, the idea is the more organizations we can get involved in this pledge program, then more of them are going to make their services better for their clients, and ultimately that is a really significant way to improve and increase health equity.
Yeah, and then just a quick summary slide of our entire Health Confianza project to kind of bring it all back to the beginning is over the 2 years that we've been working with over 45 community partners across our 3 levels of strategies. And you can see the blue at the community, the yellow at our kind of interpersonal communication training, and the red at the pledge program. We've been able to reach well over 9,800 folks across those 22 zip codes that I presented to you earlier. And in fact, this reach is much greater than that. I mean, it's in terms of our social media reach and the reach that our pledge program partners have made, which we have not yet really documented. We're confident that we've made an impact in terms of raising awareness about the concepts of health literacy and how they are essential to promoting health equity amongst our marginalized populations here in San Antonio. And we really look forward to kind of building upon these relationships and partnerships so we can continue to build the capacity of both our organizations that we partner with to address health equity issues, their staff and their teams through our trainings, and then ultimately provide them with additional skills, resources to reach into the communities with plain language information and empower those natural leaders to, again, help people make the best decisions for themselves. So I think on behalf of Melanie, myself, and our entire Health Confianza team, we want to thank you so much for joining us today. I'm going to put up one quick contact slide for us. If you would like to reach out to get more information, we can be reached at our confianza@utesca.edu contact information. You can follow us on our social media handles to see what kind of information our marketing communications team is putting out there. And we'd love to kind of hear from you about how you may take some of these principles and work that we've talked about here today into your own work. Melanie, do you want to add anything there?
Yeah, I think there's one more slide.
Yeah.
So I just wanted to make sure you had the resources that you might need in order to replicate your own pledge program. The first one we didn't really talk about, but there is a health literacy map. In case you're not aware, that University of North Carolina developed from the 2003 NAHL Health Literacy Survey, which is the only national federally funded health literacy survey that we have. So I know it sounds really old, but we can only assume that health literacy is not getting better as our health system gets more complex. What that map does is take health literacy rates by, I believe it's by census code. And so you can see in your own community pockets of where they have lower health literacy and, better health literacy. And so that might be helpful for you. The other documents are things that I've already talked about. And the very last one, the CDC has a lot of health literacy resources. If you haven't gone there to their website recently, they cover everything. And so I just highly encourage you to take advantage of all these different resources.
And I'll just underline one last thing, which is if you are embarking upon whether it's internal organizational change or promoting that change with other institutions, Cotter's Leading Change is, in my mind, an essential toolkit to help help get that process going. And if you haven't read it yet, it's very accessible, very easy to use. The Harvard Business Review has a shorter version of the article, which kind of encapsulates the key points, but engaging leadership at an early stage is absolutely essential, and it walks you through other steps. So again, thank you so much. And Melanie, you get the last words.
I thank you all. I'm reading your comments there. Hopefully this will be sent out to you by IHA. It's been a joy and a pleasure speaking with you this afternoon. I welcome any follow-up questions or comments that you have as you work on your own initiatives. So thank you for being here today.
Have a great day, everyone.